Hi, I'm Kevin Brigle. I'm a nurse practitioner and I practice at the Massey Comprehensive Cancer Center at the Virginia Commonwealth University down the road in Richmond, Virginia. And I'm here at JADPRO 2025 at the National Harbor in Maryland. I was an instructor in the pre-conference workshop, and it's a workshop for bone marrow biopsies, lumbar punctures, and Ommaya access. And this workshop has been going on for a little over a decade now. And so we've had full sessions every time, so there's obviously a need to educate students, nurse practitioners on these procedures. The goal of the workshop itself is really to instruct students on proper technique, to basically have them deliver a really good procedure and technique to patients, and really improve safety and the comfort level for the patients mainly. These procedures, no patient likes procedures, and procedures can really be anxiety provoking. And the procedures which I was responsible for, the lumbar punctures and the Ommaya access, can actually be some of the most anxiety provoking procedures. And so, as learning really good technique, teaching the nurse practitioners how to talk to patients before, during, and after the procedures, really it can increase their comfort level. And it makes it a little bit easier then the next time you do the procedure. So for the next person, whether it's you or the other person, if that procedure is done really, really well. And I think some of the key takeaways, and I think students understand that while these simulations, these models really only approximate what it's like to actually do the procedure on a real patient, that really learning the technique and getting the repetition down makes it a little bit easier, then increases your comfort level when you actually are starting to work with a regular patient. And really the point of this whole thing as well is that nurse practitioners, PAs, really across the United States and in many practices are being called upon to do these procedures. And so it adds value to our profession, of course, but also it's important to do these things correctly. And so I think that's really the key takeaway, is that repetition is really the way to go on this.